Now, I've been a medical biller for a doctor's office for almost 20 years now. Now, it hasn't been the same doctor's office, and some have been my clients for my business, some I have worked for as an employee. But regardless of that, there's one thing that I can tell you, and that is that the medical billing job is not a one-size-fits-all when it comes to billing for a doctor's office. Now, we're going to go through a few things that I believe is different when you apply to different doctor's offices, or you get a job at a different doctor's office, or even if you have a client because you have a business and you work for a different doctor. There are certain things that I think change up a little bit. But I wanted to go over first, what is the difference between medical billing and coding? And so you might ask me, what does that have to do with working as a medical biller in a doctor's office? I always get questions that ask about medical billing and coding, that they want to get a job, what's entailed, and all of those things. But as usual, they always clump it together. Medical billing and coding. Now, I know if you heard anything about medical billing or medical coding, you always seem to hear it together, like if it's one word or one job, one profession, but it is not. So I think it's important for me to just at first tell you the difference, tell you the definition of what a medical biller is and what a medical coder is. So a medical coder is the person who takes the medical records, they read the records, they review it, and then from those records, they choose alphanumeric or numeric codes that will then go on the claim form. So before I get to the claim form, let me go back. The medical coder is reading the records. The medical coder always reviews the records. They have to look through the records. They need to see what is in the records so they can choose the correct diagnosis codes and procedure codes so that they can then put that in the chart for the patient. Now, a biller, on the other hand, then takes those codes that the coder takes. They take those codes, they put them on the claim form, they send out patient statements, and they try to get the provider paid for the services that were rendered to the patient. So the difference is that a coder always looks through the charts, or they should always be looking through the charts, making sure that the documentation is correct, making sure that it is clear and the provider has written down everything they need to that will correspond with the codes that they choose as far as diagnoses and the CPT codes, which is the procedure codes. A biller, on the other hand, does not have to necessarily look in the chart. And I say not necessarily because, again, it depends on the practice, and we'll go further into that. But a biller doesn't necessarily have to look in the charts. So we can take whatever codes we receive, and from there, we send it out on the claim forms. Like I said, we send it out as a patient statement, and we try to get that paid. So a medical biller's job and a medical coder's job is two different jobs. Now, there are times, though, that you might have a title as a medical biller or have a title as a medical coder, but you are actually doing both of those jobs. Now, in my opinion, when it comes to private practice, that is when the waters get murky when it comes to medical billing and coding. So from what I hear, because I've always worked for private practice, when a person works in the hospital and they're a medical coder, they are a medical coder, and that's what they do. They don't do billing, they don't do credentialing, they don't do all the other things. They do coding. And if they are a biller and they are supposed to send out claims or resubmit claims or post payments, then they are a biller. They do just that. Their jobs are very distinct and they know what they're supposed to do. Now, if in their contract or in their title, they have to do more duties, that would be in their contract. But for the most part, in hospitals, there are so many people working there that you are able to say someone is just a payment poster, someone is just a coder, someone just submits claims. It is easier to say that because you have more people doing it and there are lots of claims that they have to do. So they might have the job of just submitting claims, but there are so many claims that they have to send out in a day that is enough for them. But in a doctor's office, on the other hand, especially most private practices, you might have a private practice that only has one provider, or even if it has 2 or 3 providers, they don't have the amount of claims that a hospital has. So that person who is titled as a coder or a biller may have a lot of different duties to do. So we're going to jump into the first thing about being a medical biller in a doctor's office. And that thing, which is the most important thing, I believe, is the duties that that person have. Now, regardless of what your title is in that doctor's office, whether they consider you a medical biller or they consider you a medical coder, if you are doing more positions than you're supposed to, if you are coding, looking in the chart, deciding what the CPT codes and the diagnosis codes are supposed to be, sending out the claims, doing patient statements, credentialing the provider, then you are doing more than just billing. Billing is not coding, and coding is not billing. Now, I hope I'm not getting on you guys' nerves and just really stressing that, but I get this question so many times that sometimes it's hard for me to even answer that. And that's why I decided to do this video, because someone might ask me, well, what's the duties of a medical biller and coder? And what's it's hard to say that in a doctor's office because we tend to wear so many hats when we're in the doctor's office. And so you might think that that is just a regular duty that you have. A lot of billers believe that they are supposed to code, and they believe that they're supposed to be able to just choose a code, and sometimes they don't even read the charts, they just choose the code, and that now they're doing their billing part. But in actuality, a biller should not be coding unless they have the title of coder. A lot of times though, a provider believes that if you are a biller, then you automatically will code. So you need to make sure that they understand what you're supposed to be doing and you understand what you're supposed to be doing. So if you get a job as a medical biller, your duties can be an array of things. It can be coding, it can be billing, it can be credentialing, it can be bookkeeping, it can be being the office manager, doing front desk duties. It can be so many things. So when you ask me the question of what will my job look like if I get a job as a medical biller, I can't really tell you that because I don't know what the practice that you're working for will require of you. They might require of you just to do the billing, which they should, and if that's what they're paying you for, that's all they should require you to do. But if in your duties or job description says that you're supposed to be coding and you're supposed to be doing eligibility and you're supposed to be checking in patients and you're supposed to be collecting payments then for me personally, you're doing way more than just billing. Now remember, you can schedule your remote one-on-one with me. I have 45 minutes and 90-minute sessions. You can ask your questions about medical billing, about the difference between medical billing and coding, about schools that you can take, about books that you can read. Whatever question you have about medical billing, if you want to start a medical billing business, I can answer those questions for you. Remember, on this remote one-on-one though, I am not answering any questions about how to actually bill. But anything else you have about billing that you want to know, make sure you schedule your remote one-on-ones. I will leave the link on the screen and in the description box below. Now, the second thing about being a medical biller in a doctor's office is your experience. Now, like I said, for me, I've only worked in a doctor's office, but I feel like I have gotten an advantage doing that because talking to other billers who may have just worked in the hospital, some of them don't really know the end-to-end billing cycle because they are only required to do certain parts. They might be required to just deal with denials, or they might just deal with payment posting, or they might just deal with one certain type of denial. But for me, as an end-to-end biller, meaning I was the only biller and I did everything from start to finish, I learned a lot. I got a lot of experience in how to deal with different issues when it comes to billing. So when you work in a private practice or a doctor's office, and it's a small doctor's office, for the most part, they're not going to have a separate person doing each part of the billing. So that can help you a lot when it comes to experience. So if you go to another office after working in one of the other offices, you can use that experience that you have gained in order to maybe get a position in another doctor's office. Maybe to be the manager or the billing manager of that doctor's office, a bigger doctor's office. You might also be able to get into the hospital easier because now you know how to post payments on a regular basis, and you know how to do it, and you know how to do denials, and you have that advantage of experience and knowing all the things that you have to do and not just being good in one area. Now, for me, I always like to learn a lot of different things. And they like to say, if you're a jack of all trades, but you're a master at none. And to an extent, I can get that. But I still think that it is a good thing for you to know a lot of different things. So you can either choose what you really like to do, or you can just, like I said, work all the areas and know how to work all the areas. And the third thing about working as a medical biller in the doctor's office is your education. Now, when I started off as a medical biller, I didn't have any certifications. I only took a class in electronic medical billing, whatever that was at the time, but I only took that class, so I really didn't have much experience or much education. The person who trained me for the 2-week period, but they couldn't tell me everything within that 2 weeks time. But as the time went on, I started to realize what I needed to know, what I didn't know, and I started to take classes on my own. So I started off by taking a medical billing class because I felt like I needed the foundations to be able to understand the guidelines and the rules and laws and what this means and what that means. I thought I needed more of a foundation of billing, and that's exactly what I did. I took the class and then I got certified. But as I also kept doing billing over and over and over, I started to notice that although I was not coding, because the doctors that I work for, they code for themselves, I still needed to understand and know coding. I needed to know why they were choosing these different codes and if they had the information in there, because doctors may code for themselves, but they're not, or let me not say they're not, but most of them are not staying up on the guidelines and the rules and what they should, code and what they shouldn't code and what goes together and what doesn't go together. A lot of them don't stay up on that. So I felt like I needed to know if I was sending out the right things on the bills. Although the provider did give me that information, I needed to make sure that I was sending out the right thing. So then I took a coding class, of which coding is not my specialty at all. I just use that information to help me out to be able to talk to the doctors and let them understand why they can or cannot use a specific code. And I know how to use the code books. It wasn't required of me as a biller, but I think it helped me be more marketable. It helped me feel more comfortable in billing out what I needed to bill out. But it was not necessary. So depending on what your duties are, though, you may or may not want to branch out into other areas like coding, credentialing, all of those things, because you might need to do that in order to do your job. If you're working in a hospital and you're doing no coding whatsoever, you're only doing claims, and you only decide that that's what you want to do, then you might not have to go and take a class in coding. You might not even need to see what those are. If you send out a claim and it gets denied and you're not the one who deals with denials, again, you don't need to know that information. But if you decide that you want to branch out, that you want to, you might be moving to a different job that might require you to do that, I always say it will never hurt. It should benefit you if you decide to learn more things that can help you along the way. So if you like this video, then I think you'll love this video. And I'll see you again in my next one.